Hi there, and welcome to A&P with Dr. O. Now we are looking at an inferior view of the skull, and I have removed the mandible. That way it's going to make things just a little bit easier to see. One thing that we can see in this orientation is we can see the underside of the maxilla here. And then just posterior to that, we have the palatine bone. So this right here would be the palatine bone. You can think about the roof of the mouth as being the palate. It's a good way to remember that this is the palatine bone right here. We can still see our foramen magnum. And then on either side of that foramen magnum, we have these smooth areas here, and those are known as occipital condyles. And a condyle is a smooth, rounded articular process. This is going to allow the skull to articulate with cervical vertebrae number 1. And that cervical vertebrae number 1, we're going to find out, is also called the atlas. What we can also see is we can also see the pterygoid processes. These are part of the sphenoid bone. Remember, the sphenoid bone combined with the ethmoid bone looked like a bat. And I like to think about the pterygoid processes as the legs of the bat because they hang down underneath the bat. And here we can see portions of the sphenoid bone here. And so coming down then from the underside, we have the pterygoid processes of the sphenoid bone. As part of the temporal bone, we can also see the mandibular fossa on either side here. Those would be our mandibular fossa. Anytime we hear the word fossa, it's a shallow depression, and this is where the mandible is going to articulate with the temporal bone. One more thing to note, earlier we mentioned that this was the palatine bone and that this was a portion of the maxilla. And this portion of the maxilla is known as the palatine process. It along with the palatine bone, are going to form part of the palate, the roof of the mouth. Again, the palatine process of the maxilla, and then we have the palatine bone.